I imagine a big part of your work has to do with helping them not only negotiate sexual risk, but their emotional sense of self, their self-esteem, their self-worth.
Absolutely. Those are many of the factors that put them at risk for sexual risk, that when a girl in our community, in our society, has a low sense of self-esteem, battles with a sense or with a healthy sense of well-being, she's more likely to seek out in the environment reinforcements that help her to feel better about herself. Legitimate ones that are healthy, and also ones that are not so healthy. And so sexual risk, as well as drug and alcohol use and abuse and other forms of seeking out to sort of soothe uncomfortable feelings, are some of the things that I work with the girls on.
Yeah. And as I hear you say the word soothe, one of the things that comes up with me is this whole idea of coping skills and taking care of oneself. Some of your work centers around women, mental health, and health outcomes. What role do you think gender plays in looking at mental health, mental illness, emotional well-being, and coping skills? That's a lot.
I think that gender plays a very unique role. I think my work, theoretically, I work from a perspective of looking at the socio-cultural context, and that's essentially looking at the environments, the social values, the community values, and the cultural values that sort of play into the way that a woman or anyone would experience their symptoms or in their experience of life. I feel that for women in particular and girls in their development, that there is a sense of being marginalized and a little less empowered, and so for that reason there's likely to be self-blame, a lack of understanding, and a lack of appreciation from the outside world about the internal experiences of women and girls. So I think that leads to sort of feeling alone at times around wellness and what her own experience is.
Do you think that there are any issues that are particularly relevant to girls and women as it relates to mental health?
I do. I think that, well, one that we can all connect to, I think, is just a couple of years back, this notion that a woman's premenstrual cycle was somehow required medication. I don't know if you all remember the commercials for that, and I thought, wow, that's interesting. So instead of dealing with maybe perhaps what's happening hormonally for her and what's going on for her in terms of just natural biorhythms and whatnot, we've problematized this. We've made it an issue that needs medication, and certainly there is room for that, certainly. But this idea that all women who are experiencing some of the most natural processes of a woman's life and body experience, that is somehow a pathology, I find very interesting, and that's just one of them.
Yeah, that's a good example. I think many women can relate to this whole idea of feeling like when you're upset or frustrated or irritable, that there's something wrong with you. It must be that time of the month, hormonally, that even if you are experiencing hormonal changes or responses, that there is something deviant about that.
Right.
Yeah, well, that was with my experience when I was younger. I always had depression, didn't get diagnosed until I was in my 20s. Because they're like, oh, it's just your hormones, don't worry about it, it's normal, I'm being crazy because my hormones. But in reality, I was, depressed and feeling all those feelings because I was depressed and I needed help. And a lot of men I found that I would talk to, or doctors that I would go to, they're like, oh, it's just your hormones, don't worry about it, you're not like this, all the time, every month. And I'm like, I really am. I might have maybe a couple good days during the month, but that's basically it.
Yeah. So it sounds like your experience as a female, being a woman, has impacted your treatment or seeking out support from medical providers.
Oh, it definitely has. Like I said, I didn't get diagnosed until my middle 20s, So all that time I could have had, a better childhood if I was diagnosed, if it wasn't just poo-pooed away that, oh, it's just your hormones, you're a woman, it's that time of the month.
I just imagine how much better it could have been for Christine had she just had some understanding and some legitimacy centered around what she was experiencing as opposed to it's not happening.
Right, exactly.
What Christine brings up also reminds me a bit of what you were saying about some of your work with girls. And, you know, I'm curious in terms of what your observations have been in terms of urban living, city living, and how that impacts how girls relate to their moods, feelings, different things like that.
Oh my goodness. I think I run an after-school program for girls, and in that program we've used some centering exercises, including yoga, affirmations, very soft and relaxing music. And part of that is just because the environment is so chaotic. I think we take for granted how active and stimulating, overstimulating the urban environment is. My experience with the girls and my work with them, and even in recapping on research that we've done and that I've done with facilitators who have made observations on the girls in the groups, is just noticing what a relief they experienced, that they observed in the girls' experience of the group, and that watching the shoulders fall and the breathing start to deepen and things like that. And you realize that these young girls are really carrying around a lot of stress in the same ways that adult men and women are. Our experience trying to commute to work is stressful, and they often have the same commute or same types of commuting experiences on buses and subways, and they are also trying to figure out how to transition from space to space, and in the midst of puberty and other challenges that are going on, needless to say if their home environment is stable or not. And so I think that there are a lot of ways that the urban environment sort of creates a complicated set of circumstances that these girls have to negotiate. And my work with them, or my goal, is to help them to figure out, to develop the coping skills and strategies to negotiate that effectively so that they can remain a bit sane in the process of it.
And, you know, as I hear you talk about coping skills, I want to hear more from Christine about coping skills. But before we even get there, I want to hear a little bit about your experience in terms of dealing with your own mental health struggles.
Well, when I was younger, it was very difficult because, like, I had my mom and I didn't get along that well. And I think a lot of the reasons why is because, you know, my hormones were so out of whack, and I wasn't thinking things, you know, clearly, and so it brought up a lot of issues between the two of us. And I feel like if I was diagnosed when I was younger, I think we would have been able to have a better relationship. And, you know, like I said, I've been to, you know, psychiatrists, and you sit down and talk, and half of them just write and they don't say anything back, or they say, oh, you're right, they're looking at it wrong, they're wrong, you're right. And I'm sitting to myself, apparently I'm not right, apparently I'm here and I need help, and I need you to help me understand what it is that's going on that I'm not getting.
How long of a journey has it been for you in terms of getting a diagnosis, getting adequate treatment, and learning healthy coping skills?
Well, I was, like I said, it was in my late, you know, middle 20s when I got diagnosed. And I went to one doctor, and he goes, there's nothing wrong with you. And I'm like, no, there is. So I went to another doctor, and I'm like, this is my symptoms. You know, I'm sad, I can't get out of bed, I lose jobs, I've lost relationships. You know, I'm self-medicating myself with whatever it is, and I'm like, this is not healthy, I need help.
So you were able to identify all of these things within you as being something that was hugely problematic.
Yeah. You know, after I realized I was losing job after job, or I was losing relationships, I'm like, there's something not right, that I have to do something. And I found a doctor who actually would, you know, sit there and listen to me and talk, and he goes, okay, well, you've got anxiety and depression, and this is what you need to be. So I started on different medications, and some of the medications didn't really work until I found one that did. And then it would work for a while, and then I would have to up my dose, and I wasn't comfortable with that, but I did it anyway, and I found that it helped me cope.
And outside of medication, connected more with where Dr. Williams was discussing helping girls negotiate their environment as well as develop coping skills, have you found that there are certain environmental conditions that support or isn't helpful towards your mental health? Have you participated in any treatment mechanisms like therapy, exercise, yoga?
Well, I do a lot of exercise. You know, I have a dog, so I walk my dog a lot, and that helped, you know, when I was really down. But I have a great support system. And I have a big family who, you know, supports me and loves me. So I found that very helpful.
Yeah. Was your family supportive when you were diagnosed?
Yes and no. Some people weren't. They're like, oh, you're just using, that's just a diagnosis. You know, you're just using that as an excuse. You're not really that way.
All the perks that come along with it.
Oh, absolutely. And then some people are like,
Yeah.
well, that makes sense.
Yeah.
I could see where that's coming from.
Yeah.
You know, like my mom said, oh, yeah, you have depression. I knew that. It's like, but if you knew that, why didn't you get me help?
Yeah, yeah. I definitely agree with what both of you are saying, that there's something about being female that oftentimes impacts our ability to get appropriate diagnosis and treatment, or sometimes we're misdiagnosed. In the work that you do with girls, do you find any similarities to some of the work or some of your observations and research with women?
I do. I think that that girls and women are often sort of, they look more similar than they look different. My experiences in working with women and the research that I do about women's mental health and the ways that race and gender sort of intersect in their lives shows up in terms of the amounts of stress that they're experiencing, the inability to cope effectively, and now having more access to coping strategies that maybe are not as functional for them. So for example, the use of drugs and alcohol, or even self-medicating with, you know, behaviorally, you talked about that, Christine. So with regard to sex or food, the ways that they're managing their relationships. And so it's just sort of an extension of, I see girls also being, you know, in the midst of their development and their puberty, but also being overly sexualized and looking for validation in those spaces.
Now, when you say overly sexualized, do you mean by the media? Do you mean at home, in their neighborhoods?
All of that. I think that that's also a characteristic of an urban environment because there's more access to direct experiences with other people just by virtue of having more that's public and more being in the public, more away from protected spaces. For example, on subways and buses, as well as media, and the media that is, you know, appropriate for Times Square may not be appropriate for adolescent girls developing a self-concept. And so, and that's one example, but you know, there's plenty of commercials and television where we see a lot of just
well, it's also like you have to be super thin, and this is the way you have to look, and this is the way you have to dress, and this is the way you have to act. So, you know, girls have this ideal of what they're supposed to be, and it might not be age appropriate for them. You know, and there's lots of stress because it's a male-dominated world. So it's like, okay, you've got to be a mother, you got to be, you know, a daughter or whatever, and you still have to have a career, and you still have to have kids, and it's a lot more stress, and you got to prove yourself a lot more.
Yeah, and I think also just to tell a 12-year-old or a 14-year-old that you need to be sexy when you're still developing a sexuality is a little bit putting the cart before the horse. And so how do you do that? And a lot of it comes from emulation from what we see on television in terms of thinness and all those different things. So,
and you know, I totally agree with both of you, and I imagine as a mother or a father or any caregiver or parent watching the show, they would say, but I never tell my kid around that age, my daughter, to be sexy. However, I would argue, and I think both of you might have similar opinions, that the messages aren't always direct.
Not at all.
It's like friends, you know. You have one parent in the class of 20 kids, and they let their kids do whatever they want to do. And then they come in with magazines, let's say, or they start talking, and they all talk amongst themselves. And even if you have, like, parent controls, you know, on television stuff, you still see things. All those, you know, shows that are up there, even on Disney.
I'd say, too, I have, I don't have children of my own, but I now have friends who have children who are of that age of, you know, going from elementary school to middle school, and it's a very interesting way, or thing rather, that plays out with parents and how they engage their competition around parenting through their children. And so it may not be that there are direct messages around sexiness, but there are messages around the types of clothes that you bought your child, the brands, because they're now you know, manifesting it in that way, whereas maybe moms would compete with other women. Now moms are competing with other mothers through their daughters or through their sons, and fathers through their sons and daughters. So I think even that it's not an explicit message from mom or dad, there's certainly something that's happening.
This is interesting because we're talking a lot about the ways in which women's emotional sense of self, self-esteem, self-worth is impacted. But I also think at the other end, is the outcomes. One of the things you talk about is women's health outcomes as it relates to their mental health, stress. You want to say a little bit more about that?
Sure. You know, in the work that I do with the girls, it's difficult work because it's a bit abstract for them, but to make the link between the way that you feel about yourself, your self-esteem, whether you feel calm and relaxed as opposed to overly stimulated and anxious, connects to then how you behave. And your behaviors can be health promoting or health defacing, right? And so that has a direct link to a health outcome. And so there are studies that have been done, and we know it to be true for our own selves that, you know, if you feel great, you're probably more likely to eat a fruit. If you feel awful, you want comfort foods, and those are the foods in high fat, sugar, and salt. And so as it relates to sexual risk vulnerability, I want to share with the girls that there are different states of mind that you are in that either make you feel powerful and happy and in love with yourself that won't permit you to be mistreated by a boy or another girl or a friend or even your mother, that you're likely to stand up for yourself. And so as that relates to being in a relationship sexually, you'll negotiate condom use and whether even to permit boundaries to be crossed with a bit more precision than you would if you did not feel good about yourself. And so there's a direct link, I think, between your mental wellness and well-being and your physical health. Not wearing a condom or not having those barrier methods can lead to syphilis, chlamydia, and even AIDS or HIV or AIDS rather. So it's a direct link.
And I'm also thinking, and